So there are some health benefits that have been associated with coffee drinkers, but these have been based mainly on observational studies or epidemiological evidence and not really cause and effect type of research. So some of the health benefits that have been associated with coffee drinkers are a reduced incidence in Parkinson's disease in coffee drinkers versus non-coffee drinkers, and that finding was actually especially prevalent in men. There was another interesting finding that in women specifically, that coffee drinkers tended to have less cognitive decline in healthy older women without dementia already, that it seemed that the coffee drinkers had less of a decline in their cognition than non-coffee drinkers. Something else interesting was that there seemed to be less risk of liver cancer and liver cirrhosis in coffee drinkers versus non-coffee drinkers. And stroke. There was a study, a nurse's health study in 2009 that showed that there was about a 23% reduction in stroke in women who drank coffee versus those who didn't. So those are really interesting findings that certainly bear more research to determine whether it is actually the coffee that is creating these associations or whether it is some other aspect in that person's lifestyle, diet, etc. Or the adverse effects of coffee on your health, I guess, again, mostly are pertaining to the caffeine content of coffee. But even that isn't well understood. Health Canada has actually suggested that an intake of 400 milligrams or less of caffeine per day is considered to have no adverse health effects on the average healthy Canadian. So that would be the equivalent of about 3 cups of coffee a day. So you could drink 3 cups of coffee a day and have no adverse effects of that on your health. Beyond that, it's harder to say. That there are certain individuals that are more sensitive to caffeine, and it can create symptoms of headache, irritability, anxiety, and a rapid heart rate. So for individuals who have heart disease already existing, we generally recommend to avoid caffeine because it does tend to stimulate the heart and make the heart beat faster. And that generally is not desirable in someone with existing heart disease. But not everybody has those effects, so it just depends on the person, the individual, as to how much caffeine they can actually tolerate without having those types of symptoms.